Hello everyone. Now, in our today's sessions, we will continue with our e-lecture series. We started the e-lecture series for our biopharmaceutics and pharmacokinetic subject. Introductions of the biopharmaceutics was already completed in our e-lecture series. Later on, we started the absorptions. In the absorptions, factor affecting absorptions, mainly three factors is there. One is the physicochemical factors, second one is the pharmaceutical factors, and third one is the patient related factors. So, dear all, we already discussed the physicochemical factors in our previous lectures. Now, today we will start with the pharmaceutical factors. So, let's start with the pharmaceutical factors which affect the absorptions of the drug molecules. Now, here in the pharmaceutical factors, different factors that affect the absorptions of the drug molecules. In that, first one, that is the disintegration time. So when we prepare the tablet should disintegrate within the short period of the time. Conventional tablet should disintegrate within the short period of the time. So here this disintegration time also affect the absorptions of the drug molecules. If the disintegration time of the drug molecule is too long, so ultimately disintegrations is delayed, the subsequent process, that is the dissolutions, is delayed and absorptions is delayed. So absorptions may affected by the disintegrations of the drug molecule. Second factor, that is the dissolution time. Suppose the drug is lipophilic in characters and the dissolutions of the drug is not good. If the drug is not sufficiently dissolved, suitably dissolved, that ultimately the absorptions of the drug may suffer. Third factors, that is the manufacturing variables. The manufacturing process, several manufacturing process may affect the absorption process. For example, first one, that is the method of granulations. So, dears, we know that mainly three method of granulation is there. First one is the wet granulations, second one is the dry granulations, and third one is the direct compressions. So this wet granulation, dry granulation, when we prepare the tablet, the same tablet, by the different granulation process, that dissolutions may vary. Ultimately, that absorptions is going to change. Second manufacturing variables, that is the compression force. If I prepare the tablet with the hardness of 3 and with the hardness of 7, so ultimately the dissolutions of drug will change and absorptions is also going to change. So absorptions is influenced by the different manufacturing variables. One more factors that is related to the pharmaceutical factors, that is the type of ingredients. Different ingredients that we used in preparing designing the dosage form. About the tablet dosage form, so in the tablet dosage form we use the diluent, we use the binder. So selections of this diluent, selections of the binder also play the important role in the absorptions of the drug molecules. Suppose for example, if I use the lactose and if I use the DCP, so in some of the cases, in the presence of the lactose, the absorptions of the drug is improved compared to DCP. Why? Because the lactose is hydrophilic in nature. So sometimes the selections of diluent also play the important role in absorptions of the drug molecules. If I talk about the suspension, suitable suspending agent also play the important role in the absorptions of the drug molecules. It may alter the absorption process. So here the type of ingredient also play the important role. Now next one, that is the patient related factors. Now in the patient related factors, the first factors, that is the route of administration. So we provide the drug to the patient by the different routes. Okay, it may be oral route, it may be parenteral route. In the parenteral route also the different types is there, that is the IV route, is the IM route, is the IP route is there. Now if the drug is provided by the IV route, so drug is directly enter into the systemic circulations, ultimately the absorption process is bypassed. While in other routes there is need to absorb, means the absorption process may altered by the route of administration. If I provide the drug by the oral route, so drug has to cross the absorption stage. Okay, drug should disintegrate, drug should dissolve, later on drug should absorb through the membrane. So absorption of drug is also influenced by the route of administration. Second factors, that is nature of cell membrane. So we already discussed the transport mechanisms. the drug pass through the different transport mechanisms. Passive diffusion is there, active transport mechanism is there, carrier mediated transport mechanism is there. So here this cell membrane may alter the drug absorptions. Suppose if the drug is favorable for the passive diffusions, the drug should be in the non-ionic form, then only it is passed by the passive diffusions mechanisms. Okay, so this factors is already discussed in our last lecture. Now next one, that is the age. So dears, in infants the gastric pH is high and intestinal surface and blood flow to the GI tract is low, resulting in the altered the absorption pattern in compared to the adult. Now in elder patient the gastric emptying is altered, decrease the intestinal surface area and gastric blood flow. The higher incidence of the echlorhydria, okay, so impact the drug absorption process. So according to age, means in the infants, in the adult, in the elder persons, the absorption process may alter. Okay, second one, that is the gastric emptying time. Now what is the meaning of gastric emptying time? So gastric emptying time means the process to emptying the content to the small intestine, that is called as the gastric emptying time, the process by which the food leave the stomach and enter into the duodenum. The rapid gastric emptying is required when the drug is best absorbed from the distal part of the small intestines, and delay gastric emptying is required when the drug absorbed from the proximal part of the small intestines and prolonged drug absorption site contact is desired. Now, if I talk about the factors affecting gastric emptying, so different factors that affect the gastric emptying process, in that the volume of meal is there, type of meal is there, physical state of the gastric content is there, body positions is there, drug that is given with the drug molecules, emotional condition is there, disease condition is there. This all the factors will affect the gastric emptying process. One more factors that affect the absorptions of the drug molecules, that is the gastrointestinal pH. pH also affect the absorptions of the drug molecule. We already discussed in the physicochemical factors, the pH is important for the ionized form and unionized form of the drug molecules. So some of the drug is remain in the unionized form in the upper part of GI tract, and some of the drug is remain in the unionized form in the lower part of GI tract. So if the proportions of the drug in unionized form is more, then the drug absorptions is more. So which part, at which pH the drug is remain in the unionized form, that part is considered as the absorption window of the drug molecules. Now the next factor, that is the disease condition. So achlorhydria means they may not have the adequate productions of the acid in the stomach. So stomach HCl is not going to secrete it, and if the pH is not going to decrease, so ultimately some of the drug molecule that best absorptions from the stomach area where the pH is comparatively less, but here the acid is not going to secrete sufficiently, so pH is not decreased sufficiently, so absorptions of this type of drug may be altered in these conditions. Second one, that is the cardiovascular disease conditions also altered the absorptions of the drug molecule. So several change associated with the congestive cardiac failures influence the bioavailability of the drug, edema of the intestine, decrease the blood flow to the GI tract and gastric emptying rate, and alter the GI pH, secretions and secretion and microflora. So this all the factors is influenced by the cardiac problem, and it may alter the absorptions of the drug molecule. Next one, that is a pre-systemic metabolism. Absorptions of the drug is also affected by the pre-systemic metabolism. Now what is the meaning of pre-systemic metabolism? It is also called as a first pass metabolism. Means before entering into the systemic circulations, drug is going to metabolize. So different factors affect the metabolism of the drug molecules. Okay, different enzymes is responsible for the absorptions of the drug molecule, in which the luminal enzymes is there, gut wall enzymes is there, bacterial enzymes is there, hepatic enzyme is there. These enzymes degrade the drug molecules. It will metabolize the drug molecule before entering into the systemic circulation, before absorption process. So absorptions of this drug molecule, viability of this drug molecule, it may influence by this process. So here our factors affecting absorption is completed. Now you can see this all the video on our YouTube channel, that is a Pharma Ignites. Please subscribe our YouTube channel, that is a Pharma Ignite. Okay, thank you very much.